I'm pleased to join my colleague from New Hampshire on the floor and the others who have spoken this morning so eloquently about the heroin and opioid epidemic that is ravaging families and communities in every one of our states. And as Senator Ayotte said so well, we have seen in New Hampshire that we are at ground zero for this epidemic. It is, in terms of the percentage of people affected in New Hampshire, we're losing a higher percentage than almost every state in the nation. And this is something that we need to work together to address, and we've got to respond much more robustly, I think, than we have done at the federal level, because this epidemic has become a pandemic. It's affecting young and old, urban and rural, rich and poor, white and minorities. As others have spoken, the Senate is now considering the Comprehensive Addiction and Recovery Act, or CARA, and I want to congratulate the sponsors of the legislation, because this is a good bipartisan bill. It's important as we look at what we need to do to address the epidemic that we face. But in addition to the authorizations and the good work that's in the CARA legislation, we also need to provide the resources that law enforcement and health professionals who are on the front lines of dealing with this crisis are going to need. Because despite heroic efforts, law enforcement and treatment professionals are increasingly overwhelmed by the sheer scope and scale of the opioid and heroin crisis. Everywhere I go in New Hampshire, the lack of resources is abundantly clear. Our communities need additional funding, and they need it urgently. So that's why I've introduced an amendment co-sponsored by the author of CARA, Senator Whitehouse, and I'm pleased that my colleague from New Hampshire has also joined in co-sponsoring this amendment. What it would do is provide $600 million in emergency funding for critical programs that we know will help address this crisis. I'm on the floor today to urge the majority leader and the leadership of the Senate to allow a vote on this legislation, because this is a nationwide emergency of the first order, and it's time for us in Congress to treat it like a nationwide emergency. In 2014, more than 47,000 Americans died from lethal drug overdoses, more fatalities than from car accidents. So each day, 120 Americans die of drug overdoses, 2 deaths every hour. In our state of New Hampshire, where we have 1.3 million people, we're losing more than a person a day to drug overdoses deaths. And here we have a map of America that shows the increases in deaths from drug overdoses. We can see in 2003, the majority of the map is lighter colored, so it means it doesn't have the same number of deaths. In 2008, we can see this dark red color, which shows the drug overdoses, the deaths from drug overdoses increasing. And here in 2014, we see the impact of those 47,000 people lost. And the presiding officer, like in New Hampshire, is at ground zero in the state of Arizona. In West Virginia, in Tennessee and Kentucky, they're seeing the same dramatic increase in the number of deaths from drug overdoses. This chart represents overdose deaths per 100,000 people, and again, it demonstrates how truly national in scope the crisis has become. No state is immune from the scourge, and across the country, our communities are asking why this is happening. They're asking why so many of our family members and neighbors are overdosing on these drugs. And sadly, as people have spoken on the floor, one of the primary reasons is because so many people are becoming addicted to prescription opioid drugs, better known as painkillers. So in 2012, 259 million prescriptions were written for these drugs, almost one for every American. That's more than enough to give every American adult their own bottle of pills. During a 3-month stretch in 2015 in New Hampshire, 13 million doses of Schedule II painkillers were dispensed at New Hampshire pharmacies in just one 3-month period. 13 million pills in 3 months for a state with a population of 1.3 million. And nearly 80% of these prescriptions were for heavy painkillers like oxycodone, morphine, and fentanyl. And if we look, we can see how this graph dramatically tracks the increase in drug prescribing and the number of deaths that result. The number of drug overdose deaths has risen as opioid prescriptions have increased. So just go back to this chart for a minute, because this orange line is the number of deaths. The green line is the number of prescriptions that are being written. We're missing the data for the year 2012, but there's no doubt that those deaths track the number of prescriptions for painkillers that are being written. The National Institutes of Health have found that people who are addicted to opioid painkillers are 40 times more likely to be addicted to heroin. So when someone gets addicted to pain pills and can no longer get prescriptions, they turn to drugs like heroin and fentanyl. What I heard from law enforcement in New Hampshire and from the medical community is that people turn to heroin because it's cheaper and easier to get than prescription drugs after they become addicted. And of course, we've seen that drug traffickers are taking advantage. They're flooding our streets with these drugs, and in many of our communities, that bag of heroin is cheaper than a 6-pack of beer. And of course, the end result is a staggering increase in overdose deaths, which we can see on this chart. Again, in 2014, nearly 21,000 people died from opioid abuse. There were more than 10,000 deaths from heroin. That's a 222% increase from 2009 levels. And so we can see these are opioid deaths, these are deaths from cocaine, and these are deaths from heroin. And we can see the red line and the green line have gone up dramatically. A professor at Johns Hopkins School of Public Health, Brendan Salinger, describes the opioid addiction as, I quote, a chronic relapsing illness, just like diabetes. We know that treatment is the only effective answer. Again, what I've heard from law enforcement in New Hampshire is that they know they can't put drug users in jail, but that's not the answer to deal with this challenge. We need to put the bad guys in jail, but we need to provide treatment to the people who need it, because that's the only effective answer. And unfortunately, it is a tragic reality that nationwide, nearly 9 out of 10 people with substance use disorders don't receive treatment. They're being turned away and denied treatment due to a chronic lack of resources. My colleague from New Hampshire spoke very eloquently about some of the people she's heard from. We've heard from people in the same way in New Hampshire. Of the 1.3 million people in our state, it's estimated that 100,000 people, almost 10%, are currently seeking treatment for substance use disorders. And we're able to offer services to only a small fraction of that total. Over the last decade, the number of people admitted to state treatment programs increased 90% for heroin use and 500% for prescription drug use, with the largest increases occurring in the past several years. And so, as we can see from this chart, lack of treatment is a national problem. The darker the green, the more people in that state who are not receiving treatment for addiction. So, sadly, New Hampshire is a very dark green. So is Arizona, the presiding officer's state. And we can see this dark green pattern coming down the East Coast and going up the West Coast. In 2014 in Kentucky, 82,000 people needed addiction treatment but failed to get it. In Tennessee, 116,000 people. In Arizona, 157,000. In Nevada, 55,000. In North Carolina, 200,000 people. These are all people who needed treatment, who didn't get it. And when people don't get treatment, they are overdosing in overwhelming numbers. And sadly, this map of the United States shows where the overdose death rates are the highest. The darkest the color, those death rates are greater than 19 per 100,000 population. And again, we can see many of the same states, like New Hampshire, that have the most difficulty in people finding treatment are the states where we're seeing the highest death rates. In 2014 in Kentucky, 1,100 people died from a drug overdose. In Tennessee, 1,200 people. In Arizona, 1,200 overdose deaths. In Nevada, 500. In North Carolina, 1,300. In recent days, I've had a chance to visit 3 treatment centers in my home state: Headrest in Lebanon, Serenity Place in Manchester, and Seacoast Youth Services in Seabrook. These treatment centers are staffed by skilled, dedicated professionals. They're saving lives every day, but they tell me that for every life they save, many more are being lost for lack of treatment capacity, lack of facilities, and lack of funding. And you know, I had a chance on some of those visits to meet with some of the people in recovery. And I can remember one young man up in Lebanon at Headrest who had been in and out of prison because of crimes committed when he was using. And one of the things he said to me was, you know, it costs thousands of dollars to keep someone in prison. The figure he used was $35,000. He said, don't you all know that it's cheaper to give somebody treatment? It is absolutely more cost-effective for us to provide treatment to people who are in recovery, people who need help. I heard from a young woman in Manchester who said that she had been arrested for drug use. And she said, no, I'm not a criminal. She said, my problem is I need treatment to deal with these drugs. Another young woman who was in her early 20s who had been in and out of the Manchester jail, the Valley Street jail, and she said, you know, they don't provide treatment in the Valley Street jail. So I've learned that when I get picked up, I don't tell them that I have a drug problem or that I have mental health issues. She said, because if I do, they put me in the bubble where I get observed 24 hours a day, regardless of what I'm doing. And what I need is treatment. I don't need to be in the bubble. Well, that's why this supplemental amendment would increase resources for treatment and recovery, because the answer is treatment. Our amendment includes $300 million for the Substance Abuse Prevention and Treatment Block Grant Program. This program is the premier federal initiative to boost state and local resources for prevention, treatment, and recovery support. And in 21 states, this block grant represents at least 75% of the state agency's substance abuse prevention budget. And in some states, sadly, it is the only funding for substance abuse prevention. So if we're going to get a handle on this problem, we've got to provide some additional resources for the treatment that these programs need. This funding will result in an immediate increase in the number of addicted individuals who will receive life-saving treatment, and it will also save taxpayer dollars in the future, just like I heard from that young man at Headrest who said it's cheaper to provide treatment than to build prisons. He's absolutely right. The National Institute on Drug Abuse estimates that for every dollar spent on substance use disorder treatment programs, there is a $4 to $7 reduction in the cost of drug-related crimes. And outpatient treatment programs can result in savings that exceed costs by a factor of 12 to 1. I live in Stratford County in New Hampshire. It has used the modest funding from this block grant program, the Substance Abuse and Treatment Block Grant, to accomplish important things, including expanding its peer-based addiction recovery efforts and working in schools to engage at-risk students in the middle school years, because if we can prevent addiction, that's obviously the best thing we can do. But unfortunately, many prevention and treatment efforts in Stratford County remain chronically underfunded. I recently learned about one local woman, a mother and waitress, who overdosed in front of her 2-year-old child. Fortunately, she received inpatient treatment, and now she's doing well, but others have not been so lucky. Like cities and counties all across America, Stratford has a months-long waiting list for those needing treatment. And when people with substance use disorders are turned away, they remain on the streets, desperate, often committing crimes to support their addiction, always at constant risk of a lethal overdose. Vice News in New Hampshire recently profiled the opioid epidemic. The reporter interviewed one desperate user who said this, and I quote, "I tried to get help and stop, but at the treatment center they said I'd have to wait 3 months. I had to go to the hospital and tell them I was going to kill myself just to get admitted. That should not happen in America." Another critical tool in the effort to stem the tide of this crisis are prescription drug monitoring programs. These state-run programs collect, monitor, and analyze electronically transmitted prescribing and dispensing data submitted by pharmacies and dispensing practitioners. Now, we know monitoring works. We've got the data to show that it works, but only half of the 50 states are receiving federal support. So what this amendment would do, the emergency supplemental amendment, it would include $50 million for the CDC to expand and bolster state drug monitoring programs. Our amendment also allocates $10 million to improve access in high-risk communities to medication-assisted treatment services for heroin and prescription opioids, because numerous studies have shown the effectiveness of including medication in the treatment of some individuals with substance use disorders. So medications like methadone, buprenorphine, and naltrexone have been shown to reduce opioid use. Our supplemental spending amendment would also speed emergency resources to law enforcement agencies, because while, as I said, I've heard from police in New Hampshire that they can't solve this problem by putting people in jail, they can help to solve it by putting traffickers in jail and by breaking up those networks that are supplying drugs. In recent years, the opioid epidemic has spread to small towns and rural areas in every part of the country. And if we went back to that first map of the United States, we could see just how much the spread has been to rural parts of this country. Heroin traffickers in New York expressly target New Hampshire, Vermont, and Maine, all states with a large rural population. We don't have any real urban areas in our states, but we can see the spread of those drugs in northern New England. This amendment would provide $230 million in emergency funding for Edward Byrne Memorial Justice Assistance grants and $10 million for COPS Anti-Heroin Task Force grants. The Byrne JAG grant program is the nation's cornerstone crime-fighting program, and it's proved its effectiveness in each of our states, which is why it enjoys such strong bipartisan support. But the program has suffered cuts. In New Hampshire, we received $1.7 million in Byrne funding in 2007. Last year, we received less than $1 million, almost a 50% reduction. You know, I had the chance to travel with Senator Hoeven down to our southern border of Texas last spring, because we both are on the Department of Homeland Security Appropriations Subcommittee. And we talked to some of our Customs and Border Patrol employees who were down on the border in Laredo, who were interdicting drugs down on our southern border. And one of the things they talked about is that drugs are coming across our southern border, and they're going up the interstate highway system. So they're going up Interstate 95 to northern New Hampshire, they're going up Interstate 35 up through the middle of the country. And we've got to provide law enforcement with the funds they need to interdict those traffickers. We need an infusion of new funding to mobilize so that the programs are more aggressive for stopping opioid traffickers and dealers. Our amendment requires that burn JAG funds be used directly to combat the opioid crisis for this emergency funding. And that'll allow for programs that emphasize treatment over incarceration, like drug courts. In New Hampshire, we've seen what a difference it can make to have well-resourced, ambitious law enforcement initiatives. From May to December of last year, a high-intensity drug trafficking areas task force, so the HIDTA task force, based in Bedford, New Hampshire, carried out Operation Trident. They drew on federal, state, and local law enforcement resources in New Hampshire and Massachusetts, which makes sense. The more we cooperate, the better we can respond. Operation Trident resulted in 240 arrests. They took down 4 major heroin fentanyl trafficking organizations. They dismantled 3 processing mills, and they seized more than $1.2 million in assets. But what we've got to do is to continue to recreate these successes all across the country by moving aggressively to take down the gangs and other trafficking organizations that are feeding the opioid epidemic. And to do that, we've got to provide resources. This emergency funding amendment doesn't create any new programs. Instead, we fund proven and effective initiatives like Burn JAG and the Substance Abuse Prevention and Treatment Block Grants. These initiatives have earned broad bipartisan support because all of us senators have seen the good work that they do in each of our states. And by allocating emergency resources to these proven programs, this amendment will provide law enforcement and treatment professionals with the resources they need to go on the offensive to mobilize a real war on opioid trafficking and addiction. And perhaps most important, our emergency supplemental funding amendment funds the programs that are included in the CARA bill. And I want to thank Senator Whitehouse and the other drafters of CARA who have made important statutory and programmatic changes to improve programs that help treat addiction. But CARA, as important as it is an authorization bill, and it doesn't provide any funding. If we support making the changes in the law that are included in the CARA bill, then we should also support the funding needed to make these programs work. And this is a quote from the National Governors Association. Recently, they came together and they endorsed emergency appropriations to address this crisis. They wrote, and I quote, "Governors applaud the introduction of legislation that would provide emergency assistance to states working on the front lines of the opioid crisis. Investment is needed to help states mount an effective response to opioid addiction, from increasing prevention and education regarding the dangers of illicit drugs, to strengthening state prescription drug monitoring programs, expanding access to addiction treatment, and enhancing support for law enforcement," end quote. The Fraternal Order of Police has endorsed this amendment. They've written, "This bill will help our state and local law enforcement officers by giving them the necessary funding and tools to battle their community's heroin and opioid problems. Something needs to be done," end quote. Mr. President, I ask unanimous consent to place the Fraternal Order of Police support letter into the record.
Without objection.
Thank you. We've also gotten support from groups like the American Academy of Pain Management, the American Public Health Association, the American Society of Addiction Medicine, Association of Women's Health, Obstetric and Neonatal Nurses, from the Partnership for Drug-Free Kids, from the American College of Physicians, the National Association of State Alcohol and Drug Abuse Directors, and again, I won't read this whole list, Mr. President, but would ask unanimous consent to enter the list into the record.
Without objection.
Now, the question is, why do we need emergency funding? Well, some of my colleagues have argued that additional funds are not needed because there was enough money for the opioid crisis in last year's omnibus. And yes, it's true, there is additional funding for these programs in the omnibus. I sit on the Appropriations Committee. I was one of many on that committee who worked very hard to fight for those dollars. But with spending caps in place, these increases are modest at best. And the majority of my supplemental amendment appropriates resources to two programs, the Substance Abuse Prevention and Treatment Block Grant and the Burn JAG program. These programs have been critically underfunded in recent years. For example, the Substance Abuse Prevention and Treatment Block Grant received a small increase in the omnibus. That was good. But the reality is that over the last 10 years, funding for this program has not kept up with healthcare inflation. So we've got a 26% decrease in the real value of funding despite the small increase we got in the appropriations process. In order to restore the block grant to its purchasing power from 10 years ago now, before we had the explosion of the opioid and heroin crisis, but just to get back to that level, Congress would need to allocate an additional $483 million for fiscal year 2017. My amendment provides $300 million for this program. It's a down payment, only a down payment, on where we need to be. And the Burn JAG program has been flat funded for the last 3 years. 15 years ago, again, before the explosion of the heroin opioid crisis, Congress provided more than $1 billion in support to state and local law enforcement through Burn, JAG, and block grant funding. By 2015, that number was reduced to $376 million. So right now, despite the explosion in this heroin and opioid crisis, we're providing only about 1/3 of the support that we provided 15 years ago. The reality is that criminal justice, prevention, and treatment have been chronically underfunded, and as the result, deaths have continued to rise.
It's consumed 27 minutes.
Thank you, Mr. President. I should be finished shortly. Now, we've talked to the Department of Justice and to Health and Human Services, and they are both ready to get this funding at the door immediately because there is no time to wait. Law enforcement and healthcare providers on the front lines need this money, and they need this money now. Now, in the past, Congress has risen to the challenge of epidemics. In 2009, Congress appropriated nearly $2 billion in emergency funding to fight swine flu, which claimed the lives of about 12,000 Americans. And that emergency appropriations bill passed the Senate 86-3. 51 senators who voted for that bill are still serving in this chamber, including 23 Republican senators and every member of the Republican leadership. And last year, Congress approved $5.4 billion funding to combat the Ebola outbreak in West Africa, an outbreak that killed only 1 American. Surely we can come together now, this year, in this session, to fight a raging epidemic right here at home. We can't avert our eyes from 47,000 Americans who are being killed by lethal overdoses each year. We can't accept that 9 out of 10 Americans with substance use disorders go without treatment. We can't ignore the fact that law enforcement officers in communities across this country are overwhelmed by aggressive drug traffickers and a rising tide of opioid-related crimes. CARA will help fight the heroin and opioid epidemic in the longer term. But I urge my colleagues to also support this emergency supplemental funding amendment because it will provide urgent emergency funding to ramp up this fight in the months immediately ahead. This is a nationwide crisis, and it is time we mobilize a nationwide response that is equal to the challenge. So I urge my colleagues, I urge the majority leader to allow a vote on my amendment to pass this out so we can give our local communities and our states the resources they need. Thank you, Mr. President. I yield the floor.